Hi everyone, it's Miss Rail here. We are going to go over the answers to the insurance terms to know worksheet that you did so that you can make any corrections to your worksheet or write out any notes that you want to for use on the upcoming exam. So let's get started. Definition number 1 was for pre-existing condition. This is a medical condition that existed in the patient before they received insurance coverage. Number 2, referral. When a patient requests that their patient see another doctor, usually a specialist, for a particular health problem. Example, a family practice doctor refers a patient with a broken arm to an orthopedic or a bone specialist for casting. Number 3, copayment. A specific amount of money a patient pays for a particular service. Example, a patient may have to pay $20 for each doctor visit regardless of the total cost of the visit. They would have to pay this amount at the time of service. So every time that patient went to see that doctor, they have to pay a new $20 just to be seen by that doctor. Then, if they owe anything else for the visit, they'll receive a bill and then they will pay their part that they're responsible for at a later time. Coinsurance. This requires that a specific percentage of expenses are shared between the patient and the insurance company. Example, in an 80-20% coinsurance, the insurance company pays 80% of the expenses and the patient pays 20%. When you see a coinsurance percentage written, the first number is always the insurance company's responsibility and the second number is always the patient's responsibility. So if you see a 65-35 split, the insurance company would be responsible for 65%. The patient would be responsible for 35%. Deductible. This is the amount paid by the patient for the medical services before the insurance policy begins to pay any benefits towards coverage at all. So until that patient has met their deductible, they have to pay all costs out of pocket 100%. After they have paid that deductible, meaning that they've paid whatever amount the insurance company says they have to pay out of pocket, as soon as they hit that limit, then the coinsurance kicks in and the insurance begins to cover their portion of the bill. Beneficiary. This is the designated person who receives the benefits from an insurance policy. Example, a spouse is usually the beneficiary on the other spouse's life insurance policy. Managed care. The practice of attempting to decrease the cost of health care while improving the quality of care. This is done to lower costs while still providing the best care possible for a community. Preferred provider. This is a physician, hospital, or other healthcare agency who has an agreement with a PPO to provide services at a discounted rate. If you see PPO in the definition, you think preferred provider as your answer. Preventative care. These are measures taken to prevent disease and injuries rather than curing them or treating the symptoms. If you can prevent something from happening, this is much better than letting a problem develop or an illness develop and having to treat it afterwards. Premium, a fee that an individual pays to the insurance company monthly for health insurance. This is paid regardless of whether or not you use any of those insurance benefits, and it is non-refundable. So if I pay $100 a month towards my insurance premium, at the end of the year, I have paid a total of $1,200 towards my premium, and I don't get that back regardless of how much or how little I have used my insurance benefits. If you don't pay your premium, say for example, you quit paying your premium, then you lose access to that insurance policy and it will not cover any benefits in the event that you wind up ill or injured. Affordable Care Act. This is a law passed by Congress in 2010 that expanded the number of people covered by health insurance. It also did away with pre-existing conditions, meaning that insurance companies were no longer able to deny patients insurance coverage based on a condition that they had prior to the start of that individual insurance policy. There are a couple of terms that may or may not have been on your sheet, but you definitely want to make sure that you know these. So write them on a piece of paper so that you have them handy for the exam. The first is in-network provider. These are doctors or hospitals with which the health plan has negotiated a discount. Insured persons on a particular insurance policy pay less for services when they use an in-network provider. Explanation of benefits, also known as an EOB. This is a document sent by an insurer to a patient explaining what was covered for a particular medical service, how they arrived at the payment amount, and the patient responsibility amount. So this is not a bill. When a patient gets this in the mail from their insurance company, it is an explanation of how those benefits were awarded. It says what amount they approved for that service to be paid at. It states how much the healthcare provider should expect to receive for that service. And then of the remaining balance, how much the patient is responsible for. That is still not a bill. The patient will receive a bill from the healthcare provider where they had the medical service performed at a later time, and then that is when the patient pays their responsibility. So the EOB is basically giving the patient a heads up saying, don't forget, you are responsible for this amount of the service. This is your responsibility. And in the near future, you are going to receive a bill from that doctor, from that hospital, from that other service provider. And then you would pay them what you owe. COBRA. This is a federal law that lets you continue to buy health insurance for up to 18 months if you lose your job or insurance coverage is terminated. It usually costs a lot because the individual now has to pay the entire premium, including the amount that your employer was paying. So if they were covering 100% of your premium, you now have to start paying that premium 100%. If they covered a portion of it and you covered a portion of it while you were employed there, now you are responsible for the full cost of the premium. This allows you to continue to have insurance coverage while you look for another job with benefits or another insurance policy through the insurance marketplace. The last term is out-of-pocket maximum. This is the insurance person's payment obligation. Let me rephrase that. I'm sorry. The out-of-pocket maximum is the insurance person's payment obligation ends when you reach your out-of-pocket maximum. So when you hit that amount that they say this is the max amount you will have to pay in 1 year towards healthcare, once you've hit that dollar amount, then from that point forward for the rest of the year, your insurance company will pay all costs for the rest of that year related to your medical care. So if your out-of-pocket maximum is $5,000, as soon as you have paid all of your deductible, all of your co-pays, and all of your co-insurance amounts. As soon as you hit that $5,000, you will no longer then have to pay anything towards healthcare for the rest of that calendar year through December 31st. The insurance company will cover it 100%. However, as soon as January 1st of the next year hits, then everything resets to zero and you are once again responsible for paying your amount. Now, insurance premiums do not apply to this. You still have to pay your insurance premium, even if you've hit your out-of-pocket maximum. It does not count towards the cost of your deductible and towards your out-of-pocket max. So regardless of what's going on and how much you have paid in terms of healthcare services, you still have to pay your premium every month or you lose access to your insurance. So make sure to correct any definitions that you may have had incorrect on your worksheet and study those for your exam. Thank you and good luck studying.